Diarrhea is the condition characterized by frequent bowel movements. At least 3 loose, watery bowel movements each day. Diarrhea may be watery or bloody. Loose but non-watery stools in babies are normal, especially who is breastfeed. Most common causes of acute diarrhea is infections such as viral, bacterial and parasites. Diarrhea caused by infections is called gastroenteritis. In travelers, bacterial infections predominate. Various toxins such as mushroom poisoning and drugs can also cause acute diarrhea. Norovirus is the most common cause of viral diarrhea in adults. Shiga toxin-producing Escherichia coli are the most common cause of infectious bloody diarrhea in the United States. Campylobacter spp are a common cause of bacterial diarrhea, but infections by Salmonella spp, Shigella spp, and some strains of Escherichia coli are also a frequent cause. Viruses are most common cause of diarrhea, rotavirus in children under 5 years of age. The duration of diarrhea may be for several days or several weeks. These infections commonly are acquired from food or water that has been contaminated by feces, or from another infected person directly. If blood is present, it is also known as dysentery. Diarrhea may be caused non-infectious diseases. These include lactose intolerance, irritable bowel syndrome, non-celiac gluten sensitivity, celiac disease, and other diseases. Diarrhea causes dehydration and loss of electrolytes and minerals. Eventually may have serious complications. Diarrhea can be prevented by improved sanitation, drinking clean water, and hand washing with soap. Controlling for helminth infection and early breastfeeding is important because children who had experienced severe diarrhea had significantly lower scores on intelligence tests. In the elderly, particularly those who have been treated with antibiotics for unrelated infections, a toxin produced by Clostridioides difficile often causes severe diarrhea. Management. In many cases of diarrhea, replacing lost fluid and salts is the only treatment needed. This is usually by mouth, oral rehydration therapy, or, in severe cases, intravenously. Oral rehydration solution, ORS, a slightly sweetened and salty water, can be used to prevent dehydration. If not available commercially, oral rehydration solution, you can prepare it at home. Home solutions such as salted rice water, salted yogurt drinks, vegetable and chicken soups with salt can be given. According WHO, homemade ORS consisting of 1 liter water with 1 teaspoon salt, 3 grams, and 2 tablespoons sugar, 18 grams, added, approximately the taste of tears. Too much salt and sugar is not recommended because it may cause more loss of fluid. Parasites, particularly protozoa, for example, Cryptosporidium spp, Giardia spp and Amoeba histolytica, Blastocystis spp, Cyclospora chiatonensis, are frequently the cause of diarrhea that involves chronic infection. The broad-spectrum antiparasitic agent nitazoxanide has shown efficacy against many diarrhea-causing parasites. Zinc supplementation proved successful, showing a significant decrease in the incidence of diarrheal disease compared to a control group. Appropriate amounts of supplemental zinc and potassium should be added if available. Vaccination, for example, cholera vaccine showed a strong reduction in morbidity and mortality. Breastfeeding practices have been shown to have a dramatic effect on the incidence of diarrheal disease in poor populations. Diet restrictions is not needed. Anybody who have diarrhea can eat healthy and clear food. Drinks with sugar, soft drinks and fruit juices, are not recommended in children. Loperamide are effective at reducing the number of stools but not the duration of disease. These agents should be used only if bloody diarrhea is not present. Resveratrol, an anti-secretory medication, may be used to treat diarrhea in children and adults. 91. It has better tolerability than loperamide, as it causes less constipation and flatulence. 99. However, it has little benefit in improving acute diarrhea in children.